The ASHP Research and Education Foundation, in partnership with the Cardinal Health Foundation, is proud to introduce the finalists and recipient of the 2007 Award for Excellence in Medication Use Safety. No other award recognizes the critical leadership role that pharmacists play in improving and promoting medication safety in hospitals and health systems across the United States. The first of our two finalists is Community Health Network in Indianapolis. In 2005, 80% of Community Health Network's patients had at least one unresolved issue with a medication on their admission histories. The organization used a systematic approach to develop, design, and implement an action plan that would improve both their admission history and medication reconciliation processes. A team instituted a successful medication history and reconciliation program that led to the authorization of additional pharmacy staff. Partnering with the IT department, the team developed an innovative approach to notifying pharmacists of new patients' admissions, which allowed for more timely completion of medication histories. The new process also implemented electronic signature documentation by pharmacists in the medical record, which immediately alerted other hospital staff to the updated medication histories. Community Health Network's program significantly reduced unresolved medication issues. During the first 3 quarters of 2007, pharmacists documented medication histories of more than 21,000 patients. Involving pharmacists in medication histories has decreased unreconciled medications at Community Health Network by a remarkable 73%. Congratulations on your achievements. The second of our two finalists is Mercy Health Center in Oklahoma City. In 2003, Mercy's Falls and Restraints Committee began benchmarking the number of patient falls and related injuries by reporting them to a national database. This practice made Mercy aware that its fall rate exceeded the national average. In response, a pharmacist was added to the Falls and Restraints Committee, and the pharmacy developed a medication fall risk score, which identifies medications as having a high, medium, or low fall risk value. These tools and the involvement of pharmacists in fall prevention evolved into the development of the Pharmacy Falls Prevention Program. The Medication Fall Risk Score is used to determine if a patient needs further evaluation by a pharmacist. Both pharmacists and nurses evaluate patient medication profiles for fall risk according to their respective assessments. Specific drug therapy interventions are then recommended by pharmacists and are frequently implemented to help reduce patient falls. Since the implementation and use of the Pharmacy Fall Prevention Program, there has been a substantial decrease in the number of falls and fall-related injuries. The results have been impressive. A little over 1 year after implementation, injury falls decreased by 32%. Congratulations on your achievements and innovative approach to reducing patient falls. And now, let's meet the winner of the 2007 Award for Excellence in Medication Use Safety, Barnes Jewish Hospital in St. Louis, Missouri. Barnes Jewish Hospital is a 1,200-bed university-based teaching hospital. Each year, approximately 1,200 of the hospital's patients are diagnosed with sepsis, and approximately 2 years ago, a multidisciplinary team set out to improve sepsis diagnosis and treatment.
Well, prior to the Sepsis Bundle project, the mortality rate was substantially higher for patients. Patients would be treated less aggressively, perhaps, fluid replenishment, not as aggressive, antibiotics delayed.
The key elements weren't missing, but the way I like to think about it, they weren't tied together.
Scott had worked with Dr. Marin Koloff, who's with Critical Care Medicine, and developed some care path guidelines.
So what we did here locally was essentially had a meeting of the minds where we'd come up with an order set, a product of standardization.
When Scott Misek and Brent Ruoff were working on the order sets with the Critical Care Committee, that was an entirely separate process, and it was getting consensus and buy-in and making sure we were all speaking the same language.
The attitude of both the physicians and the pharmacists was very positive and very welcoming. Really, Scott helped us facilitate the order set along with our physician champion, Brent Ruoff, through the Medical Executive Committee.
I think we realized that there was already trending in the direction that we kind of expected, and that was pretty exciting.
A key criterion for this award is the overall scope of the project. Applicants must demonstrate that the medication use initiative was system-wide, relied on teamwork, had detailed planning and implementation phases, and yielded measurable results.
To effectively make this process work, it requires a multi-dimensional team, not only from the walk in the door at recognition by the triage nurse, but then the pass off to the nurse, staff nurse, as well as the physician that's going to take care of them.
To streamline and rationalize patient care, it does make it easier, and I think that that's the biggest benefit of the program, is that we see a standardized approach to every patient with severe sepsis.
The effort, the multidisciplinary effort from our hospital, both from pharmacists, nurses, physicians, respiratory therapists, etc. Without everyone's help, we would not be where we are today.
Scott's effort was different in that it was able to demonstrate both clinical success and improved outcomes for the patients, and also an improvement in the financial results, so a higher quality at lower cost.
The results of this project were impressive and are an example for other institutions. Barnes-Jewish Hospital clearly demonstrated that standardizing sepsis care translated into significantly improved patient outcomes. Congratulations on being the recipient of the 2007 Award for Excellence in Medication Use Safety.